Tourette syndrome is also known as TS. It is characterized by rapid, repetitive, and involuntary movements and vocal noises that are referred to as tics. Tourette syndrome is also known as TS. It is characterized by rapid, repetitive, and involuntary movements and vocal noises that are referred to as tics. The word involuntary is stressed when it comes to describing Tourette syndrome, since people with this condition tend to be confused since they do not have control over their movement. There are two types of tics, motor and vocal. Motor tics include eye blinking, head jerking, shoulder shrugging, facial grimacing, nose twitching, jumping, touching other people and things, twirling, repetitive movements of limbs or torso, pulling at clothing, or hitting and or biting oneself. Vocal tics can include throat clearing, barking, squealing, grunting, gulping, sniffing, tongue clicking, uttering words or phrases, coprolalia, which is the involuntary utterance of inappropriate words, echolalia, which is repeating a sound word or phrase, or polylalia, which is repeating one's own words. OCD, which is obsessive compulsive disorder, is also a characteristic of Tourette's. A person with TS may feel the need to do something over and over again. An example of this is touching an object with one hand after touching it with the other to even it out, or checking to see if a fire on the stove is put out. ADHD, or attention deficit and or hyperactivity disorder, is another characteristic of TS. Students with TS may have difficulty in concentrating, failing to finish tasks, acting on impulse, seeming if they aren't listening, needing supervision, being unable to sit still, and showing a lack of self-control. Other behavioral patterns include compulsive and repetitive patterns, sleep problems, depression, poor self-esteem, irritability, poor school performance, social isolation, and school or social phobia. Some other behavioral problems associated with TS can also deal with aggressiveness and uncooperative behaviors. Meet Alex. Alex is my 10th grade student who has Tourette's. On top of having Tourette syndrome, he prefers gender-neutral pronouns. Preferring these pronouns aren't related to having Tourette's, but it's something that as a teacher I need to accommodate to. These pronouns include ze and zer. Alex, however, does well in school compared to the average student with Tourette syndrome. He was diagnosed at the age of 7 and he is currently in 10th grade, so he did have some time to adapt. He wants to be referred to as Z. However, his involuntary movements and vocal noises and choice of pronouns can be a distraction to other students. As a teacher, we have the ability to control our classroom. Stress increases the symptoms of Tourette syndrome on the student. Therefore, we have the power to note the triggers and factors that can increase the symptoms and implement accommodations to address skill deficits and strategies that decrease anxiety. Alex's tics can be distracting to other students. However, as teachers, we can demonstrate a safe environment. If there are some tics that can be ignored, we are modeling acceptance, which can reduce bullying and stress since students with Tourette's can have a social phobia or have trouble getting along with other peers. Handwriting issues are common among students with Tourette's. This is the most common difficulty, and sometimes it hinders their learning when they are unable to read their notes or the teacher is unable to read their writing. I can put a computer or iPad for them to use or have notes provided for them, so handwriting isn't something that they have to worry about. In addition to using a tablet or computer, we can encourage the use of spell check when it comes to writing. We can waive time limits on tests to reduce anxiety, condense assignments or reduce them when allowed and appropriate, and we can verify homework assignments to make sure they were copied down correctly. Since Alex has OCD, it is important to keep the classroom nice and tidy. I would not like Alex to be distracted because of something that is out of place, since it will serve as a hindrance to his learning. It is shown that the characteristics of ADHD and OCD are harder to manage than the tics themselves. Communication with Alex and his parents are important. Alex should be included in lesson planning and agenda arranging to avoid any surprises or shocks that could add more stress. Parents should also keep in close communication with me to help Alex out with the schoolwork and help me out with how to make the classroom more comfortable. Since OCD can play a big part in the stress factor of my student, I can accommodate them. If a student has an obsession of counting words in a line, I can give them audiobooks. A student who has a perfectly sharpened pencil can be given a mechanical one. A student with a germ obsession can carry around hand sanitizer and wash their hands as needed. If a student of mine has anxiety, some things I can do include letting them leave a couple minutes before class to avoid a mass of people in crowded hallways, or having a teacher aide or educational assistant nearby for assisted supervision, or even assigning seats in the class or in other settings to avoid confusion and stress. We as teachers should be a role model when it comes to Alex identifying himself as Z and letting him use the preferred pronouns. If our students see that we aren't affected by his use of them, they should be able to not be affected by it either. As we show acceptance, it models what we expect out of our students. Another pronoun that Alex could be referred to is they. Even though they is a plural form, it doesn't identify gender like he or she does, but it keeps it gender neutral. We should encourage our students to adapt to these pronouns. It can be confusing at first and have a need for clarification and reminding, but it takes patience and practice. Everyone can have their own reason for choosing to be called these pronouns, which include personal comfort and personal identity. We can make every effort to use these pronouns that they have chosen for themselves. This may mean practicing these pronouns. They are words used to describe a person. Language is flexible and evolving, and we should be open to this adaptation. With this being said, we as teachers have an important role of creating a safe and non-bullying environment. As we model acceptance towards someone with TS and preferring to be referred to as another pronoun, we can set the example for our class to also be accepting to students that are different from them.